Hello, welcome to Lockdown Radio. Today's show, I want to talk about the court case that the Ontario Nurse Association was in 2014 and again in 2018. It was over the policy of vaccinate or mask. This was the influenza at the time, but basically, we all know it's no different than COVID. So, the title here, the headline says, ONA wins second decision on unreasonable and illogical vaccinate or mask influenza policies. News provided by Ontario Nurses Association, September 7th, 2018, 9:06 Eastern Time. I think that was AM. Toronto, September 7th, 2018, CNW. The Ontario Nurses Association, ONA, has won a second decision on the controversial vaccinate or mask policy, or VOM, striking down the policy in effect at St. Michael's Hospital and several other hospitals that from the Toronto Academic Health Science Network, or the TAHSN. Really rolls off the tongue. These policies force nurses and other healthcare workers to wear an unfitted surgical mask for the entirety of their shift if they choose not to receive the influenza vaccine. After reviewing extensive expert evidence submitted by both Ontario Nurse Association and St. Michael's Hospital, by the way, where is that evidence now? We could really use that in the year 2021. Where is that evidence? Find that evidence, which was the lead case for the TAHSN group, arbitrator William Kaplan. In his September 6 decision, found that St. Michael's VOM policy is illogical and makes no sense. It is the exact opposite of being reasonable. In reaching this conclusion, arbitrator Kaplan rejected the hospital's evidence. A copy of the full decision is available here. I will go to that in a bit. But I want to keep reading through this article because it's pretty good. William Kaplan, he was the arbitrator. Where is he now? I would love to know what William Kaplan is up to. I am going to look him up. This guy sounds like one of the good guys. He made this decision. He said it was illogical for nurses to have to wear masks all day if they didn't want the flu vaccine. So, William Kapler, L-E-R, Canadian lawyer. I think that's him. That might be him. Okay. Should we check him out on Wikipedia? Let's see. Is this Wikipedia? No, these are just images. Okay, kind of a half-assed bald guy with glasses and a suit. Looks like your average guy. Let's see, WilliamKaplan.com. If he's like a big proponent of the COVID vaccine and like tells and is in favor of masks, I'm going to lose my mind right now. Let's see. I think this is just for his legal practice. William Kaplan, arbitrator. We could use you right now, William. Anyway, nothing really here. I want to see what his stance is on, the current situation, given that only a few years ago he was a part of this huge court win in favor of freedom of choice and, basically striking down tyranny. It's funny that they were already trying this, and even in 2014, they were trying to sneak these, little sneaky ways of coercing people to get vaccines. And I'm sure that it goes back much further than that. But let's see. Okay, so we will go back to the full decision, but the TAHSN group involved in the arbitration also includes Sinai Health System, Sunnybrook Health Sciences Center, North York General Hospital, the Center for Addiction and Mental Health, Michael Garron Hospital, and Baycrest Health Sciences. Other TAHSN hospitals did not have VOM policies in place. Well, every damn one of them in the whole fucking country has one now. Holy shit. This is the second such win for the ONA. In 2015, arbitrator James Hayes struck down the same type of policy. Okay, we'll have to look up James Hayes too, maybe. Another time. I'm sure he's a beauty. The same type of policy in an arbitration that included other Ontario hospitals across the province, with Sault Ste. Area Hospital as the lead case. Hayes found that there were scant evidence that forcing nurses to use masks reduced the transmission of influenza to patients. Despite this clear ruling, the majority of THSN hospitals refused to follow Hayes' award and maintained their respective VOM policies. As a result, ONA was forced to litigate this matter again at St. Michael's Hospital. So here you have it. They have no respect for the justice, for the legal justice system. They have no respect for the Constitution, certainly. They have no respect for anything. A court has ruled that you have to strike down this policy, and they just kept doing it for 3 more years. And now the ONA is forced to go back to court on this matter. That's, I'm glad that they did. And I am hoping to see them back in court soon. That would be amazing. Let's read on. The priority of nurses across Ontario is first and foremost the safety of our patients. But these hospital policies do not protect patients, said ONA President Vicky McKenna, RN. ONA has already successfully argued against VOM policies, proving they are fundamentally flawed. And we are deeply disappointed that taxpayers' money has been wasted on having to do this all over again. Our collective agreement already protects our patients in the medical officer and health. Let me go back. Sorry about that. Our collective agreement already protects our patients if the medical officer of health determines there is an influenza outbreak by ensuring that comprehensive measures are put in place to reduce the risk of transmission to patients. So they already have a policy, but these vaccine enthusiasts would like to impose their will. ONA's well-regarded, Ontario Nurse Association's well-regarded expert witnesses, including Toronto infection control expert Dr. Michael Gardam. I am going to look him up. Just a second. There's some good people here, though. Let's say the others first. Dr. Michael Gardam, Quebec epidemiologist, Dr. Gaston Desserres, and Dr. Lisa Brassau, an American expert on masks. Interesting story about Dr. Lisa Brassau. When I first read this, this was back in the summer of 2020, and I looked her up, and her video had just been removed by YouTube. It had been removed, scrubbed from the internet, essentially, and at that time I wasn't aware of how to, find those things. But it was interesting how that happened right at the beginning of mask hysteria, which was July, August 2020 was when masks policies started really coming in around here. An American expert on masks testified there was insufficient evidence to support the St. Michael's policy and no evidence that forcing healthy nurses to wear masks during the influenza season did anything to prevent transmission of influenza in hospitals. They further testified that nurses who have no symptoms are unlikely to be real sources of transmission, and that it was not logical to force healthy, unvaccinated nurses to mask. Arbitrator Kaplan accepted this expert advice. In contrast, he noted the only fair words to describe the hospital's evidence in support of masking are insufficient, inadequate, and completely unpersuasive. Let's say those again. The evidence in supporting of masking are insufficient, inadequate, and completely unpersuasive, just like it is today with COVID. So, who's this Toronto infection expert, Michael Gardam? I wonder if he's still one of the good guys or if he's, jumped into the cottage industry of COVID-19, carved himself out a little living there, giving bullshit advice. I don't know. Let's see. Michael Gardam. Hopefully he's still good. Garin General Hospital. No, that's not him. What? Wasn't it? Yeah, Gardam. Yeah, I don't know. Can't find him. Whatever. Moving on. Okay. He also agreed with Ontario Nurse Association that there was little evidence of any positive impact on patient care outcomes as a result of the VOM policy. Both prior to and after introducing the policy, hospitals continued to experience outbreaks of influenza. He concluded the evidence supported that masks do not prevent the transmission of the influenza virus. Same way all the new studies are showing that they do not reduce transmission of COVID. You also have the British British Medical Journal study from 2015, which did the same thing. A study of cloth masks in British hospitals had no effect on the reduction of the transmission of influenza. VOM policies have been highly criticized as being a symbolic rather than scientifically based tool in the fight against influenza, added McKenna. ONA has long advocated for the development of a province-wide comprehensive influenza plan that relies on credible evidence to protect patients. We are hopeful that this second decision, we can finally put this issue to rest and focus on what matters to Ontarians, the betterment of patient care. Yes, thank you, ONA, Ontario Nurse Association. That is exactly what we want. We don't want to waste time on these vaccination and mask policies that are taking away people's freedom of choice and freedom to believe what they want. Ontario Nurse Association is the union representing more than 65,000 registered nurses and allied health professionals, as well as more than 18,000 nursing students, affiliates, providing care in hospitals, long-term care facilities, public health, the community, clinics, and industry. Visit us at www.ona.org. I wonder what they have to say these days. Let's take a look. I wonder if they're saying anything about nurses being fired. ONA, contracts and rights, member services. What do we have here? So we have a picture of a nurse wearing a full gown, N95 mask, face shield, hairnet, gloves, the 9 yards. COVID-19 Chronicles. So what's trending now? Read June 2021 PCM highlights. Urgent need for enhancing client support must resolve. Despite heroic sacrifices, Ontario healthcare workers face real wage cuts. We need precautions for airborne transmission. Well, where's their stance on nurses being fired? They should have one. They're the union that represents the nurses. How are they allowing this? This is what I don't understand about what's happening right now. They fought so hard. They went to court and fought and defeated the VOM policy. But why does COVID all of a sudden, none of that matters? None of the rights, nothing, that the process of going to court, none of that happens with COVID. And now here they are. They don't even mention anything about the current situation on their website. Everybody is turning a blind eye to tyranny. That's what's happening. Let's go back to this article.